Good afternoon, everyone. My name is Lauren Rumspecker. I am the Senior Director of Member Engagement and Communications.
I know. It does.
Coalition. On behalf of the entire BHC staff, I would like to welcome you to today's webinar on the coronavirus, keeping our workplaces and families healthy. Before I introduce today's speaker, I do have a few housekeeping items. As a result of the number of expected participants on this call, we will be muting you as you join the line. Please ensure that your phone and or computer remains muted throughout the entire presentation. If you do have a question for our speaker or any technical difficulties, please use the chat function at the bottom of your screen to type in your response, and a member of our team will get back with you shortly. We are recording today's webinar, and it will be made available by email to all participants within the next 24 hours. And with that, I would like to introduce our speaker. We are so pleased to be joined this morning by the Chief Medical Officer for SSM Health, Dr. Alexander Garza, who is responsible for quality, patient safety, and clinical analytics, and for positioning SSM Health as a leader in healthcare nationally and internationally. Previously, he served as Assistant Secretary and Chief Medical Officer to the U.S. Department of Homeland Security, an appointment he received from President Barack Obama. In that role, he legislated Health, Medical, and Biodefense Authority for DHS and played a critical role in protecting the United States from threats of terrorism. With that, I would like to hand this over to Dr. Alexander Garza. Thank you.
Okay, well, thank you, and good morning, everybody, and thanks for joining us on this conversation. Certainly is a popular topic these days. So hopefully we can convey some information during this presentation so that everybody has a good understanding on what the coronavirus is, how to protect ourselves, you know, in the at-risk populations, other sorts of things. And so we're going to go ahead and get started here. So as we do here at SSM, we are a faith-based ministry, and we like to reflect on our mission, which is through our exceptional healthcare services, we reveal the healing presence of God. So I thought what we would do first is show a short video. And so as I was preparing this webinar, which I've also done for my military unit, I came across this this really short video. It's about 5 minutes long, but I think they did a really good job of explaining where the coronavirus came from and a little bit about the disease itself. Now, some of the information that's contained within this is a little bit outdated, and I'll make sure I point that out during the rest of my slides. But I think it really is a nice way to describe what's going on. And so I'm going to click play here, and then we'll come back after the video is done. And like I said, it's about 5 minutes.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover, and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.
Okay, so a couple of things that I wanted to address about that video, which is the part where it talks about staying away from animals. That was geared towards early on in the epidemic. So when people were still, the majority of cases were in China. And so there's no transmission that's been documented from animals to humans that we know of with the coronavirus. So that piece of the video is a little bit outdated, and it was specific for China. And so I'd put that fear aside that you have to kennel your dogs and cats and things like that. So anyway, some of this information is going to be a little bit redundant, but I thought it would be important for us to walk through some of the common questions that come up regarding coronavirus. And the first one is, how is it spread? And as the video mentioned, it spreads like any other respiratory virus, which is it's through droplets. So what are droplets? So that's what comes from when you cough and when you sneeze. You're always expelling a little bit of droplets from your lungs. And if any of you have seen those high-speed photography of what a sneeze looks like, and I'm going to show you one here in a minute, and it's a little bit nasty, but it gets the point across. Although it seems, invisible to the eye, there are a lot of droplets that get expelled when people cough and sneeze, and so that's what high-speed photography looks like. And so that's an important spread. So the droplets also land on surfaces, and so surfaces then become contaminated. And that's another way that you can pick up the virus, is if somebody sneezes or coughs and the droplets land on surfaces and the surfaces aren't cleaned, or you don't wash your hands, then you can pick up the virus that way. It will typically survive on a surface. Most people are saying up to 9 hours, but it is killed by all of your common disinfectants, whether it's Lysol wipes and things like that. So that's how it is spread. the other questions are, if I'm near somebody that has coronavirus, how susceptible am I to catching the virus? And so the answer to that is it depends. If you're in close proximity, if somebody is actively sick where they're expelling a lot of droplets, and if you're around them for a long time, those are all the factors that go into what your exposure risk is. And that's all really individualized. But typically what we say is the distance is usually about a meter. And the time period is usually around, we say up to 15 to 20 minutes. But it could be more, it could be less. It also is dependent upon who the host is or who the person is that is being exposed. So, we'll go through the different risk factors, but there's a lot of things that go into exposure on whether somebody is at risk or not. So moving on, what are the symptoms of COVID-19? And so you saw in the video that it's typically fever and cough. And so those are things that are very common to any upper respiratory virus, including influenza. So the best data that we have, again, has come out of China, where that's where the majority of cases are. So in doing a lot of the epidemiological tracking on patients there, this is what was discovered. So these were the patients coming out of China. So the top two are fever and a dry cough. So just like any viral disease, they predictively have a fever. And then since it's an upper respiratory virus, it'll cause that dry cough. The rest of them, then it sort of falls off. So fatigue, sputum production, shortness of breath, things like that. That doesn't mean that at an individual level that they can or cannot have those symptoms. But if you look at this broadly within the population of coronavirus patients, this is what you'll see. And so this guides then the decisions for the CDC and for our testing as well, is looking for these symptoms to identify patients that are at risk. So next, what I wanted to cover is how infectious is COVID-19. So we saw how it spreads through the droplet transmission and exposure. So what does it mean, though, to us? So this was an infographic that was produced by some of our partners that really does a very nice job. And these are old data, so don't write down any of these numbers because they have since gone up. But they've done a nice job of showing what does infectivity look like and what does transmissibility look like. And in particular, I'll draw our attention to this graph that was in the right-hand corner. And so what this shows on the x-axis, which is that low, medium, high, that's the case fatality ratio. And as the video mentioned, and as I'll stress as well, nobody really knows what the case fatality ratio is right now. And what that is if you have a group of people that have the disease, what % of them are going to die? The problem is that we don't know what the denominator is. So we don't know how many people actually have the disease. So if you think about this, the majority of people will have mild disease. They may not come to the hospital or to their primary care physician because it's mild disease, so they're never going to get tested. So they're never going to end up in the denominator. So what you see is probably an inflated number because those are people that actually were sick enough to go and get tested. So right now it's around 2%. It'll probably go down when all is said and done. But at any length, it is more fatal than your regular influenza, which is usually around 0.01. So those are things just to keep in mind. The other piece is the transmissibility piece, and so that's on your y-axis there. And so what that tells us is if I have the disease, how many other people am I going to infect if I have the disease? Typically that number for coronavirus, what we've seen so far, is around 2.5. So that means if I'm infected with coronavirus, I am most likely going to infect 2.5 other people that are around me, which is about the same rate as influenza. So the way to think about it is if that number is above 1, then the transmission in the community continues. If it's below 1, then the transmission decreases. So that's just a good way to reference these numbers. So when you look at this compared then to other diseases, it gives you a good idea on where does this disease stand compared to other things. So certainly not as deadly as things like SARS or MERS-CoV or even the 1918 influenza pandemic. And it's not as transmissible as things like chickenpox and measles. However, it most likely will have higher mortality than seasonal influenza, and it does transmit just as widely. So the next question, and this is a question that we get a lot, is so what happens if you get COVID-19? I think this is something that we really need to get out to the community about what is the severity of the disease. And so there's a couple of nice infographics that I found on the internet that show this is what happens if you get COVID-19. So if you look at the entire population, again, this is based off of data in China. So the CDDC is the Chinese Center for Disease Control. If you look at the entire population, about 80% of them, and this has been replicated in some recent US data, 80% of them have very mild disease. So it's anything like a common cold or bad flu. 15% are going to have severe disease. Around 5% are going to be critical, so need some ICU care, things like that. And as I said before, the fatality rate now is hovering around 2%, but we do expect that to drop. Now, these are for the entire population. But of course, if you look and you start segmenting the population, you want to know, well, who are the most likely people to have severe, critical, and death? Because those are the important populations that you need to take care of. So who is at risk? So when we look at the different populations on who is more susceptible to having severe disease, it really breaks out into a demographic that looks like this. So if you look at the age groups, and then you look at the mortality rate, there's a striking difference. So most people that are in the population that have confirmed COVID are 60 degrees or younger, so that makes up the bulk of people. And that's really just because of population demographics. But if you look at the percentage of people then that have high mortality rates based on age groups, it usually starts going up at around age 60. And so another way to describe that is from this graph here, where if young, otherwise healthy people have a very low risk of mortality or severe disease. But you can see where it takes that sharp upturn at around 60 degrees, and the age group of 80 and older are the ones that are most at risk, around 15%. But you see it sharply drops off before 60 years of age. That's really what the basis is used for some of the recommendations coming out, especially regarding travel or being around large groups. So the recommendation now is that, people that are older, over 60 years old, and have some of these comorbid diseases, that they should really stay away from large gatherings, from traveling on airplanes, cruise ships, all of those other things, and to probably take some extra precaution in moving about the general public. So a little bit about death. So I mentioned that in the prior slide. And again, this is data based on China. So this is about the conditions that people have. And so we use all of this data to evaluate risk. So a large percentage of patients that were fatal cases in China had a comorbid disease. So it was either cardiovascular disease, diabetes, chronic respiratory disease, which you have to take with a little grain of salt because there's a much higher smoking prevalence in China than there is in the United States. And then other sorts of things, hypertension and cancer. And as you can think about this, cancer would be much more susceptible as well because they're immunocompromised. So their defenses aren't quite as well to protect the body against things like this. So what do you do then? So you combine all of those different things to say, who is most at risk of severe disease? And so it's people that are older, over age 60, and people that have medical conditions. I did find this other cartoon out there, though, that I think is really quite expressive, and that says most people that have mild disease are going to go to recovery. They're going to be just fine. A very small percentage of them may require hospitalization, and a very, very small percentage of them will end up leading to death. People with moderate disease, again, majority recover, and you can look down there as well. Severe even, the majority of them are going to recover. It's really those critical patients that are most at risk of death. And again, those critical patients are typically older patients with comorbid disease, young, otherwise healthy, and even I would say over 60 but otherwise healthy are at decreased risk of having severe disease and death. So moving on to this is a really good question. It's one that I get asked a lot, is how long is this going to last? So a lot of the data that we know, again, is based off of the Chinese data for how their epidemic has been going over time. So if we look at their epidemiological curve, it looks like this. So China would be the red curve, and blue would be closer to what I believe the United States is going to experience. And part of that is because, as you can see, there's protective measures put in place in the United States that didn't exist in China when the outbreak happened. So if you think about the environment in China, it was in Wuhan City, which is a very urban, densely populated city. They hadn't discovered the disease really until the outbreak had already happened. They had put in these very strict quarantine measures, but by then it was out in the population and spreading like wildfire. When you look at this curve, that's about a 2-month time before the cases start coming down. So if you look at the peak of the red curve, that's about 2 months' time before the cases really started dropping. So then you can extrapolate it to the blue curve, and as you can deduce, we're going to be in this for quite some time. So the other question I get asked is this going to die off when the summer months come along? And the answer is nobody really knows right now. So it could follow a pattern like influenza, where you get a peak in the winter and it calms down in the spring and goes away in the summer, and then occurs right back again in the fall. But what we're seeing is in our southern hemisphere, so right now we're in the throes of influenza season as well, and so we're seeing a high amount of cases of influenza. In the southern hemisphere, it's their non-influenza season, so influenza circulates around the world depending upon the hemisphere, and that's how we gauge what our vaccine is going to be. So we have seen coronavirus cases popping up in the southern hemisphere as well, and so we don't know if this is actually going to die out in the summer or what it's going to do. But the point to get across is this is going to be with us for quite some time because we're now starting to have some community spread. We are practicing social distancing rules, so no large gatherings. You've probably all seen by now that the NBA has canceled their season, parades are being canceled, and that's to prevent transmission, and that's to keep that curve flat so that we can manage the epidemic. So it's probably going to be with us for a while. Nobody can say how long, but at a minimum, at least a couple of months. So let me move on now to the next slide, and that is treatment. So right now, vaccine manufacturers, of course, are in a race to come up with what is the vaccine. And they've started their clinical trials. But vaccine manufacturing takes a long time and is very complicated because we want to make sure that in addition to making sure that the vaccine works, that it doesn't harm people as well. And so we take a lot of extra steps to make sure that this vaccine is not only going to protect people, but it's also not going to harm them. And you really can't rush those testing procedures to make sure the vaccine is both safe and effective. So then what do you do? So right now, no vaccine available. The best estimates that we have is maybe in a year this will become available. It's really supportive care only right now. We are trying some antivirals and some other therapies, but right now the majority of people that have to be admitted to the hospital, it's supportive care. And as I said, 80% are mild disease. You would treat it just like any other, common cold or flu that you have, which is Tylenol, Motrin, fluids, stay at home, all those good things. And then finally, again, to reiterate, only 80% or I should say 80% are going to have mild illness only. So really the people that are going to get hospitalized are the ones that need supportive care. So what should you do? And so this is a slide I built to really, I'm trying to put this into perspective. And so if any of you have seen the movie Contagion, I always enjoyed sort of the subplot there, the subtitle there, which is "Nothing Spreads Like Fear." And then sometimes that's tough to do when you have a lot of media that is really sort of amplifying the message. And I get it, it's a novel disease and it is having a huge social and economic impact. But we really have to boil that down into individual risk. So as I said before, clearly not everybody is at risk for severe disease, and we have to be really cognizant of that. And so if you've seen the movie Contagion, you would understand. And by the way, this movie is based off of the SARS epidemic. And so if you haven't seen it, it's actually a pretty good portrayal of an epidemic. I had the chance to meet the author of this movie, and so we were able to talk a little bit about this. And so he based it off of the SARS epidemic in 2003. Now, of course, he made it much more glamorous and much more action-packed. That's not going to happen with this epidemic. But Gwyneth Paltrow, who's the actress in the lower right-hand corner, was case number 0. So she had traveled to China, came back to the United States, and that's how the epidemic spread. And so the whole reason why I'm telling you this is because I found an interesting meme on the internet last week, which shows a scene from Contagion, which says, and this is the at the end of the movie where all the patients are being buried. It was all Gwyneth's fault. Interesting take on the movie. So what is your risk? So people call me, come to my office, ask me all the time, hey, am I at risk for coronavirus? I want to travel to this country, to that country. I want to take a cruise. I want to do all these other things. So what is your risk? And so I fall back a lot on my Homeland Security days when we talk about risk from a terrorism perspective, but it's a really useful formula to use, and I think it puts a lot of things into perspective. And that is an equation that we use, which is called the risk equation, which is threat times vulnerability times consequences. And so this is the way to look at it. So the risk is, what is my risk of contracting the disease? And so think about it in these different buckets. So the threat is, what is the threat out in the community? So do we have a lot of penetration of the virus within the community? Right now in St. Louis, we have 1 confirmed case of COVID-19. 1. There's probably others circulating out in the community that are undiagnosed. Just the probability of that happening is pretty good. But at the moment, pretty low penetration in our community. Now, who is vulnerable? So if you think about this, so the other question I get asked is, how is this different from influenza? So the reason why it's different is because nobody is immune to the coronavirus. Nobody has gotten a corona vaccine, so therefore everybody is susceptible to it. Excuse me. So, but the individual vulnerability is dependent upon some of those other factors that I spoke about. So age, comorbid diseases, things like that. Apologize. I've been talking a lot lately and so my throat gets really dry. And then the consequences are, what is my risk for severe disease or fatality or other consequences such as, am I going to get stranded in a foreign country or on a cruise ship? Excuse me. So apologize for that. So those are the ways that I think about when I'm trying to tell everybody what their individual risk is. So do you have any factors that would make you more susceptible to COVID? And then where are you traveling to? What are the risk factors there? How are you going? You add all those up and then it sort of gives you your risk picture. Okay, so moving on to travel advisories. So you've probably seen various people using face masks, which aren't recommended, by the way, but it's very common to see these out and about now. So the way that we look at the travel advisories is with the CDC travel recommendations, a level 2 or 3. And so right now there's 5 countries that are listed. This morning, or actually last evening, the president put out banning travel from Europe. So those were people from Europe traveling to the United States, not including American citizens. But there isn't an official travel advisory on Europe right now, and so that isn't included on this map. So these are countries with a high prevalence of disease where the travel advisories are going on right now. So what does that mean to us? So these are some precautions that we can take. So this is a very tried and true method, hand washing. It's very simple, but you have to make sure you're doing it the right way. But we should be doing it early, often, as many times as we can. Here's some other precautions. So to decrease the risk of transmission, if you have an employee, and you should really emphasize this to your employees, if you have a fever or a cough or you just are not feeling well, stay at home, because that's how we reduce transmission. Is if sick people are not around people that are not sick, it's not going to get transmitted. So I'd recommend a very liberal sick policy. If you're feeling ill, stay at home. Second one, have plenty of soap and hand sanitizer available for your employees. So I know there's been a run on Purell here lately. We're having a hard time even finding it for ourselves. So do what you can, though, to provide that soap and hand sanitizer. Clean and sanitize the work environment often. So as I said, the virus can live on surfaces for a certain amount of time. So if you're doing that normal cleaning, using products that can kill viruses, such as Lysol wipes, things like that, then you should be fine. But clean and sanitize as much as you can. And then what we are advising what we're actually having for our HR policies is eliminating international travel to high-risk areas. And so the guidance that we've put out is if employees are coming back from one of those Category 3 CDC, Category 2 or 3 CDC, that they're going to have to quarantine away from work for 14 days before they can come back to work. And then there's some one-offs as well. So people will come to us with a good story, and then some travel to some other area. And we take those on a case-by-case basis and really investigate what is the risk, and then make the decision then. Excuse me. So next steps. So the COVID-19 situation is changing really hour by hour. So we get CDC updates, daily. News conferences get held. Somebody says something else. Other things happen. Your local government may make another decision on whether to cancel things like that. And so what I've told our people here is what happens right now is based on what's happening right now. It's going to change in the future, and we have to be really flexible with our policies, our procedures, how we're taking care of business, because it's going to change. And as you saw on the curve that I showed, it's going to change a lot over that amount of time. Secondly, stay informed. So CDC, good website, at WHO as well. We're putting together websites for information for the public as well. If you can reach out to your primary care physician or other medical people to get good advice, but stick with reputable sources as well. And then lastly, review and evaluate your practices and make changes to your HR policies. You need to keep your employees safe. So I talked about the travel, about self-quarantine, about best practices. One of the other things that I'm asked about as well is about what's called the social distancing. So should I have some of my employees working from home or working off-site? And that's really dependent upon the community and how widely the virus is spread in the community. So right now in St. Louis, as I said, not a high degree of penetration. We do have plans at SSM. So we have, our corporate campus, which isn't taking care of patients, but certainly workers that could work from home. And so we've developed those plans where we could, when we feel like, yes, we should be doing this, or we can send some of them home with their computer, they can do that work from there. And so that's something that I would recommend as well, is what can you get by with sending employees home to do work from home? How could you stagger shifts so people aren't there all at one place at one time? We have banned what we call non-essential domestic travel, having visitors coming in, things like that. And so, it's really sort of individually dependent about what your business is, how much contact you have with public, things like that. Can you work remotely? All those other things. So those are some of the really basic overview of what COVID-19 is all about. There's a lot of information that's going to be coming out in the next week, 2 weeks to a month. And so it's really important to stay informed. But even more important is to have those plans in place so that when we do reach those critical moments where we say, okay, now is the time to implement more social distancing policies, that you're able to do those not at the last minute, but you're able to do that as a smooth process. So with that, that's going to conclude my presentation, and I'd be happy to answer any questions that are out there.
Thank you, Dr. Garza.
Sure.
And just to remind everyone on the phone that you can use the group chat function for additional questions. The recording of the webinar will be made available in about 24 hours via email. We do have one question through the group chat. Can you please elaborate why people with diabetes or other comorbid conditions are more susceptible to the death risk?
Yeah, so people with other disease processes typically do not have as robust of an immune function than people that don't have them, particularly with diabetes. And this isn't just for viral illnesses, it's with a lot of other things for people with diabetes. And so they don't have as much capacity to ramp up an immune response to the virus. And they, you know, so their capacity to combat the infection is less than people that don't have the disease. Now, certainly, there's also a range of people that have diabetes as well. You know, there's type 1 and type 2, and then how well in control people are with their diabetes. So there's a whole spectrum there that falls into it. But in general, it's because they don't have as robust of an immune response.
Thank you. Another question that's come through, there was a Bloomberg article this morning that said that COVID-19 stays in your system for 37 days. How does that relate to the current 14-day protocols being used?
Yeah, so I'll apologize. I have not seen that article, so I have to go out and read it. So the 14 days is really based off of the incubation period. So that's the quarantine period. So certainly if you're on quarantine for 14 days, and you don't have symptoms, then you can come back to work. So it would be somebody that's asymptomatic, came back, was at risk for coronavirus, quarantine them for 14 days, see if they develop disease. If they don't, then you can come back to work. So staying in the body for 37 days. So, you know, if you then did develop symptoms and that illness is going to run its course, but nobody really, and so this is probably, you know, updated news about how long should somebody stay away from work once they have the disease. Then typically it's, you know, your fever goes away, your cough goes away, you're feeling better, then you could come back to work. But I'll make sure I go back and read that article.
Thank you. And kind of related to that question, for those that, you know, whether they're an employee or not, think they might have the disease,
yes.
What are the recommendations around getting tested now that it's more widely available? And then how should employers handle people that have been tested but may not have a positive result yet?
Yeah, so very common question. It's a little bit of a complicated answer, but let me give it a shot here. So let me talk about testing first. So we have noticed patients showing up at our clinics and our urgent cares with requests to be tested for COVID because their employer has asked them to be. So they say they've been told, hey, you can't come back to work until you've tested negative for COVID. So about testing, so we follow CDC or local health department guidelines that says these are the people that need to be tested. So it's typically you have to have symptoms, you have to have some epidemiological risk, meaning you have to have traveled to a country or been around somebody that has disease, or the other third criteria is you're getting admitted to the hospital and we don't know why you have pneumonia. And so we do follow that criteria when we do our testing. And so what we want to de-emphasize is people coming that are asymptomatic, that have no risk factors, but merely want to be tested for coronavirus. That's not really who we need to be testing. We need to be testing symptomatic people. So I would discourage sending people to a clinic or to urgent care to get a presumptive negative coronavirus test. So the other piece to that is that test is just going to test you where you are right now in time and space. And so we have identified patients that have tested negative only to come back and test positive. And the reason for that is with the test, it has a threshold that the virus has to reach. You have to have so much replication of virus in order for the test to find it. If they haven't reached that threshold yet, the test isn't going to find it. So, you know, relying solely on the test can be a little bit of false hope sometimes. Now, it is true that there is more widespread availability of the test, but I will tell you this, that the state labs have some limited capacity. So even though they have widened their ability or the amount of people that can get tested, they still have to process those and get them done, and their capacity is still fairly low. There are some private labs out there like Quest and LabCorp that are now advertising that they can do this testing, and we are sending specimens to both of them. Their turnaround time is typically 3 to 4 days, and so then the question is, what do you do with people while you're waiting for this testing? Should you put them on isolation, things like that? So this is bottom line what I would say, is if somebody is febrile and has a risk factor and has a reasonable suspicion for having been around somebody with COVID virus or has traveled to one of the countries that's high risk, that's who I would recommend testing on. At some point, there will be enough virus penetrating in our community where we probably won't even need to do testing. And we do this every year with influenza. So when influenza spikes, we no longer do rapid flu testing because our sensitivity as a clinician is higher than the test then because of the prevalence in the community. So that's my recommendation for testing. And I know that was a very long-winded, complex answer, but it is challenging to make sure we're testing the right people in order to provide the right diagnosis.
Thank you. And just to summarize, so folks that should be tested are those that are at risk and or have visited certain countries or some of the other measures that you've spoken about. And likely from an employer perspective, it would be wise if someone's been tested to have them remain self-quarantined until that result comes back.
Correct.
Okay, great. We also have questions about drive-through testing or drive-by testing. Mm-hmm. Do you have any sense of if that's coming to the St. Louis area or if it's already available?
Right. And so we've been in discussions with the other major healthcare providers within the region about developing just that. And so as you can imagine, if we believe people are sick with coronavirus, we want to keep them away from our facilities to decrease risk to our patients and to our staff. And so we're right now in the process of developing the quote-unquote drive-through sampling process. So that would require, though, a screening exam up front. And so we're trying to develop either a telephone triage or an online triage so that when we identify people that have met criteria for testing, then we can tell them, please go to, this place where you're going to get sampled so you don't have to get out of your car, or maybe it's a very, a controlled entrance building or something like that. So that we keep people away from our healthcare facilities. So those are in the works right now, and I would suspect within the next, 4 to 5 days, we'll be announcing, hey, we will have this capacity. There's a lot of things that you have to think about when you're doing things like that. Like, you're going to need electricity, you're going to need, Wi-Fi, you're going to need security, you're going to need all of these other things to stand those up. And so we're working through those logistics right now.
Great. Again, on the screening, we've seen some announcements recently from health plans that are waiving copay or cost sharing for testing,
right.
office, things like that. Are you seeing that pretty consistently applied?
We are. And so as some of you may know, SSM has a health plan as well as being a health system. And so those are things that we're doing as well as waiving copays. And some insurance commissioners, I believe, are mandating a waiving of copays and things like that. I'm not an expert in the insurance world, and so I think that's about as much as I would be comfortable answering, but I rely on our folks with our health plan to give me that information. But yes, I have seen that out there.
And another question from our group chat, do you expect the CDC to add more countries to the high-risk level stratification?
Yeah, more than likely there will be additional countries added. Yeah, I think it's really just a matter of time. And so then when you get to a certain threshold, it's like, okay, so as I said, once you have more countries and then larger penetration in the community, then it becomes, okay, so now it's out in the community. Now do we really even need travel advisories because it's everywhere? So. But that's a decision that the CDC would make down the road.
From a treatment perspective, are we seeing antivirals, vitamin C, zinc being helpful in decreasing the course of the illness?
Yeah, so there are trials going on right now with different types of antivirals. So the traditional antivirals that have used to like treat influenza, things like that, have not been shown to be effective. And so there's different trials going on right now looking at other types of antivirals to see how effective they are. Using some of the evidence within China, Italy, other places. And so we're trying to pool the data now to see what has had the most effect for people in the hospitals. You know, the common over-the-counter things that you mentioned, you know, vitamin C, zinc, stuff like that, it's certainly no harm. Now, whether that decreases the period of illness or anything like that, I think is still an unanswered question.
Question regarding schools, you know, much like employers trying to decide how much, you know, effort and closures to put into place. We've seen local universities take action. Do you expect elementary, middle, high schools to be closing as well? And is that an appropriate course of action right now?
Yeah, so hard to tell. I think there will come a point in time where we may experience some school closing. So many of you are probably familiar with the Village 10 who shut their school down, but they shut it down for a day so that they could do some cleaning. So it wasn't that they had shut the entire school down. Universities are a little bit different. So they have, you know, international students. So people are coming and going. Professors are traveling internationally, things like that. And so, you know, their population mix is a little bit different than grade schools and high schools. So again, I think it goes back to that penetration within the community. If it reaches a certain threshold, I think that's when the decision will most likely be made for whether they should close schools or not. In other areas of the country, as I'm sure you've read, you know, like Seattle, the public schools are closed. We have hospitals in Madison, Wisconsin, and we found out yesterday that some of their schools are closing. So it will most likely be just a matter of time. You know, if we can slow the transmission, get us closer to, you know, summer break, that would be ideal. And maybe this spring break will help out. But it's probably just a matter of time.
Okay, and I have one final question listed.
Sure.
Just a reminder, if anyone else needs to type one in, do that now. But just, I think, as a nice summary to your talking points, if an employer is going back to their office, they want to craft a message to their employees today, what would be those kind of top 3 talking points to help with the panic and the fear that's emerging?
Yeah, so some of the top talking points that I would say is the majority of people that get coronavirus are going to have mild disease. And so think about your individual risk. So are you in an age category? Do you have those other comorbid diseases that put you at high risk? So that's one thing. Think about risk as an individual and not as a collective. And then the second part is practice all of those preventive measures that you normally would for like a bad influenza season. So making sure you're washing your hands a lot, that if you're sick, stay home. And I want to emphasize that one a lot. You know, don't feel like, you know, I'm going to gut it out and come into work, because all you're doing then is exposing your coworkers. So if you're feeling sick, stay home. And then lastly is you know, clean the surfaces around you as you would routinely, and maybe a little bit more than routine right now. So those are some of the, I think, the big talking points that I would give.
Wonderful. Well, I don't see any additional questions. So at this time, I'd like to thank Dr. Garza for joining us this morning. I know you have a very busy schedule, so we appreciate your time and your insights.
Yeah.
And thank you to everyone who joined us today on the webinar. As we said, the recording will be available within 24 hours. If you have additional questions, please feel free to reach out to a member of the St. Louis Area Business Health Coalition team or the SSM Health System, and we would be happy to guide you through some of those inquiries. Everyone have a great remainder of your week, and we hope that you all stay healthy. Thank you.